I'd like to talk a little bit about what I'm referring to as representational systems in Ericksonian strategic therapy. Now, a lot of this comes from the field of neurolinguistic programming, which was very inspired, and a good chunk of the good stuff, in my opinion, comes from the work of Dr. Milton Erickson. But this idea that we process information in our communication through our senses is a very intriguing idea, particularly in the realm of therapy, because a lot of times people don't seem to click like they could. And what a lot of researchers are finding is sometimes the words that they're using and the phrases and the way that they come up with certain output verbally was it's kind of out of sync. So most of the times you'll see this divided up into three different ways. There's visual, auditory, and kinesthetic. Now again, this is not a set in stone way to do things. I don't know if Dr. Erickson even consciously did this, but it may be helpful when you're trying to communicate with someone, particularly someone may be a little difficulty, so you can essentially speak their language, maybe not in the actual words, but the way you're presenting the words. So the first thing when I get clients who are visual, I notice a lot of times they tend to talk a lot quicker and they look up a lot when they're finding information. You'll ask them about a certain thing and they real quickly, yeah, well, it's like this, and it's like they're seeing pictures in their mind and they quickly present that. So when you're talking to somebody who's visual in that first initial stage, when you are trying to get connection and rapport, sometimes making sure that you'll say, oh, I see what you're saying, rather than, oh, I hear you. You say, I see what you're saying. Oh, I can see how that would look that way. These kind of visual related phrases, because it kind of relates them at that unconscious level to what you're saying and vice versa. So people who are visual, as I said, they might talk a little bit quicker, eyes are going up a lot, and they tend to stay in their head an awful lot. Not always, but they can get stuck there because they're watching a movie in their mind, but they're not consciously aware that they're watching a movie in their mind. Now, the second representational system is known as auditory. So this is the audio, if you will. They're listening a little more to the self-talk than they are just seeing the movie. So, for example, for an auditory person, the eyes may go to the side, like to the ears. Just you'll ask them a question, they'll kind of look over either way, and you may see them do this too: look over, then look up, then look over, and then tell you. And what's happening is they're listening to a lot more to the self-talk. They may go up to see the image to see if it corresponds, checking in with the self-talk, and it can go pretty quickly. But these are the kind of people that certain tones of voice, the pacing's tiny bit slower in the language, and they tend to talk a lot more and probably need to understand more in depth auditory output from the therapist sometimes. So you may have to go in a lot more detail with them. So they hear it, they listen, and then they come back. So if you're expecting them to go really quick with an answer, you got to back up and give them a little space, because they may take in what you're saying. So you may say something and they'll just sit there for a second looking over and then kind of up and then, yeah, or no, or whatever. And so that's important. So the language we'll sometimes use in that first session is, oh, I hear what you're saying. That sounds like that could be a problem for you. Using sounds, hearing, I'm trying to tune into where you're going. Now, like tune in, it's like a radio or whatever, and it's those are kind of these unconscious things that may help build that little bit of rapport, letting them know you are listening and you're speaking that similar language. So the third is kinesthetic. Now, this is kinesthetic is like touch, but it's also that emotional state. So you'll notice sometimes the client, their eyes will oftentimes, when they're in that kinesthetic state, they're thinking, they go down to see how they feel about something. So you may see them initially go to the side, but they'll go down. And that could be good or bad. They could be thinking about that special person. Or they could be thinking about how depressed they are, right? Now, we do all of these, but you just start to see when you pay attention to a certain pattern or how they're processing information about why they're coming to see you. So, again, if they're in that kinesthetic state, you could say something like, I know this feels pretty tough for you, and I want to be in touch with that idea you have, touch, feeling, those kind of things. You'll also notice, as an aside, clients sometimes when they think certain things, they tend to like touch themselves a little bit. Oh, I don't, I once saw a politician who his first thing when he started his spiel in front of the crowd, and I think it was very calculated, is he talked to, and I'm doing my own kind of version because I don't remember what he said verbatim. He says, I'm seeing all the problems that are out in the world today, and I'm hearing people have the solutions, and I feel that we can do better. And I'm like, wow, he did all three in that one moment to try and get in touch with everyone in the audience who may be of a good bit of differences there. So the kinesthetic, you're listening to the words about feeling, and I just feel this way, and a lot of. Now, they will tend to communicate even slower. Again, it's not intelligence, it's just the processing. They kind of go down into how that feels. So if you're trying to get them to get a cognitive concept that maybe the person who's looking up, the visual person, can get it. Oh, okay, that A equals B equals C, got it, And the auditory one goes, let me think about it. And then the kinesthetic's on the feel, well, it just doesn't feel right to me. Instead of trying to give them that information in a way that they're not responding to, may just want to listen to what particular representational system they're using, and maybe connect with that and see what's doable. And again, this isn't set in stone. This is not some consistent empirical every time. It's just a little tip on how to pace that. So when you're doing your hypnotic inductions, if you found out the person is primarily visual, well, you tie in that feeling of the body relaxing with certain sights, and then certain sounds if the person is auditory. I like to do all three when I'm doing a hypnotic induction, because once they're in that state, just make it as big a sense as possible. Well, this is a very short introduction to representational systems, and there's so much more just in this area that we could do. But I just wanted to bring that out and just say, if you haven't been playing with it, might just be listening for it, or noticing it, or feeling it, or all those three things, and maybe it can be a benefit to you. Thanks.